Myocardial Infarction, MI, treatment with beta blockers.
Hi, Mr. Jones. How are you?
I'm doing good, thank you.
Great. Now let's see. It's been about a month since you were in the hospital with the heart attack and we put in that coronary stent. How are you feeling?
Oh, I'm feeling great. I feel like a new man.
Excellent. Glad to hear that. And how are you doing with all your medicines?
You know, I can't tell you how good I feel since you put in that stent.
Good. So I assume that you're taking all your medications.
Like I said, I feel just fine.
Remember, 1 month ago, Mr. Jones suffered a myocardial infarction. He's now at greater risk for subsequent cardiac events and death. The goal is to restore his heart to the highest possible level of functioning. The American College of Cardiology Foundation and American Heart Association recommends aggressive secondary prevention using pharmaceutical interventions to lower this risk. Each of the 5 evidence-based pharmaceutical interventions works to lessen the demands on the cardiovascular system following myocardial infarction. However, it's clear in the video that Mr. Jones is not answering the provider's questions about his medication adherence. It's not clear if he's following the treatment plan. They're not communicating effectively regarding this plan. A strong patient-provider relationship is key to successful implementation of a treatment plan and care plan post-myocardial infarction. There are a number of reasons Mr. Jones may not be taking his medications. It may be due to the poor instructions from the provider. He may be experiencing adverse effects of the medication, or he may just lack understanding of the treatment, or perhaps he has inability to access or pay for the medications. It's the provider's responsibility to help the patient understand the prescribed treatment. In order to help patients understand the importance of treatments with medications, they need to explain the rationale in language and terms that the patient will understand. The focus of this video is to discuss why beta blockers are used to reduce the heart's force in pushing blood to the body in patients surviving myocardial infarction. Beta blockers, also known as beta adrenergic blocking agents, work to reduce myocardial oxygen demands of the heart in several ways. If given early enough after myocardial infarction, beta blockers have the potential to decrease the infarct size by restoring blood flow to the damaged area. Remember, conditions leading to myocardial ischemia and possible infarction occur when the oxygen demands of the heart exceed the oxygen supply to the heart. The major limitations of oxygen supply to the myocardium are atherosclerosis and the resultant plaque buildup that occurs. The body controls blood pressure, the pressure inside the arteries, by either tightening and constricting or by relaxing, also known as dilating. When blood vessels are constricted, the heart has to work harder to pump blood through them. Beta blockers work to decrease the resistance in the arteries so the heart doesn't have to work so hard to overcome that resistance, therefore reducing the heart's force. Beta blockers help dilate normal and blocked blood vessels to improve blood flow and decrease myocardial oxygen demand. Beta blockers slow heart rate. Remember that faster heart rates decrease the amount of time that the ventricle has to fill. When you have a nice slow heart rate, there are bigger gaps in time in between heartbeats, resulting in more diastolic time and therefore more perfusion time for the heart muscle. Circulating hormones like epinephrine, also called adrenaline, bind to special receptors called beta-1 adrenoceptors located throughout the heart and on the SA node to cause the heart to beat faster. Beta blockers work hard by blocking the effects of the hormone epinephrine, also known as adrenaline. When you take beta blockers, the heart beats more slowly with less force, thereby reducing blood pressure and decreasing myocardial oxygen demand. Decreasing myocardial oxygen demand and slowing the heart rate helps to reduce abnormal and dangerous heartbeats called dysrhythmias that are common when a patient experiences ischemia. Brand name drugs are listed with their generic equivalent in the parentheses. Notice that many medication names in this class and in the suffix olal. This classification makes it easy to recognize the actions of a drug that you may not be familiar with. If you see the drug that ends in olal, you'll know that it's a beta blocker. It's important for the provider to understand that the use of beta blockers is not without the risk of side effects. Provider knowledge of common side effects is important in helping alleviate patient anxiety and improving adherence to treatment plans. Changes in dosages or actual medications may be necessary. Beta blockers are helpful in reducing myocardial oxygen demand and improving blood flow to the heart. Understanding the mechanisms of medication action and being able to answer patient questions and address patient concerns about their medications plays a critical role in helping you and your patient to develop an effective treatment plan following an MI.